Again, thanks to Leah and UMass. We have at the Brain Injury Association of Massachusetts a great collaboration with UMass. We've done a lot of programs in correlation with one another. And I'm happy to be here today for this particular program to give you some insights on traumatic brain injury and ABI. And I want to be able to give you the information on how important it is to keep your brain safe. Falls are number one way in which we sustain TBI and UBI in the US. Falls are number one. And we're so, our whole lives, no matter your age, whatever age group you fall into, falls are number one. So we want to make sure that everyone here is understanding how we can try to prevent those. And if ever this was to happen, or it has happened to you, you know that we're a resource for you. Okay, so with that, again, my first name is Justine, last name Cody. I'm the Education and Program Manager at the Brain Injury Association of Massachusetts. I have been at this organization for over 10 years. I started there a couple years after college, and it was because my father, he pushed me into going this route. At the time, he had just been diagnosed with a brain tumor. And he had really just said, well, you know, I've been given back. I've had such great resources and support through Brigham and Women's in Boston for his brain tumor. He said, you know, go give back. It's not about making the big bucks, it's about helping others. And that's exactly what I did over the years in his honor, because he actually, in 2015, he was diagnosed in 2013. In 2015, he passed away from a brain tumor. So with that, I want to be able to give you a little bit of insight on who we are as an agency, so you sort of know where we came from. We've been around for many, many years, over 35 years. Basically, it was a grassroots organization that started with 4 moms that had children with brain injuries. And they knew when their children left the hospital because their bumps and bruises on the outside had healed, there was just not enough resources at that time to help them after they left the hospital. And there was just 4 particular tenacious moms that, you know, they, like many of us that may have children or loved ones, you go to the end of the earth for your loved ones, right? And they did. They said, we want to find more resources and support for our loved ones that is not available currently. And that's how they founded the Brain Injury Association of Massachusetts. Really kind of neat. It started here in Massachusetts with those 4 moms, but now there's a BIA in every state for the most part. But it started here with, again, it just goes to show the power of, you know, fighting for your loved ones and advocating for your health. And that's what these parents did. And now there's a BIA in Rhode Island, Delaware, Georgia, okay? And that started right here in Massachusetts. But there's a national branch. You may have heard of the Brain Injury Association of America. That is in DC, but again, started right here in the Commonwealth. You know, basically, again, this is sort of the background on what we do as an organization, and the Brain Injury Association of Massachusetts is a private, nonprofit organization that creates a better future for all those affected by brain injury. The purpose of the organization is to educate the public on the risk and impact of brain injury, promote programs to prevent those injuries, and advocate for improved legislation, and to offer support and resources with persons with brain injury and their families. I keep using the wrong button here. Okay, so to dive in a bit more, just so that you know how much we do for the community, I want you to know a little bit about our public policy. We actually are, because we're a private nonprofit organization, we can go to your state reps and your state legislators to help make movements. And that means things like getting more funding for people with brain injuries, getting people out of, I'm going to talk to you a little bit about the Hutchinson versus Patrick lawsuit that really started to move things. It was moving young people that had injury out of nursing homes and actually into community living. If you can think about a 16 or 17-year-old after a car crash, but they need more, they just don't have the help, but have to be out of rehab, they go to a nursing home. Not the appropriate place for that particular person. We helped with that, with our public policy over the years. And we also help with prevention laws. So the seatbelt law in Massachusetts is right now, it's secondary, which means you can't necessarily get pulled over for not wearing your seatbelt only. That's the only infraction that you have. You have to get pulled over for maybe if you're speeding or your tail light's out and then they see you don't have your seatbelt on, that's when you can be cited for that infraction. Right now we know putting your seatbelt on is so important, so we want to make it that next level. We want it to be a primary seatbelt law in Massachusetts. We're helping to pass that. We helped pass the hands-free driving law in Massachusetts that was passed in 2020. You can't hold your cell phone in Massachusetts in your car anymore. We were a huge advocate for that. Okay, I'm going to move forward here. The wrong way. Okay, so we are dedicated to change. In the last 4 decades, we were instrumental in advocating for funding and helps shape services on a national level. So I talked a little bit about what we did public policy-wise. One other thing that's really interesting is the Head Injury Treatment Service Fund. So if someone is cited for an infraction, roadway infraction like an OUI, DUI, or a speeding ticket, monies that they have to pay goes to this HITS fund that ultimately trickles down to agencies like ours to help with people that have brain injuries. So I was going to talk to you a little bit about this Hutchinson versus Patrick lawsuit. This is Kathy Hutchinson. She was the lead plaintiff along with BIA, helping with the Hutchinson versus Patrick class action lawsuit. She's a human rights activist, champion for the provision of quality home and community-based services. So basically, this is when we pivoted to take people out of nursing home living and into community service living, independent living, and group homes and on waivers. She also was the first woman to have robotic arm surgery. So she was a huge advocate, along with BIA's help, to get, again, people with TBIs, traumatic brain injuries, out of group homes, out of nursing homes and into community living. And that sort of, this right here, this particular slide dives into that a bit, but the discharge and transition of 713 individuals from institutional and residential to residential community living. That's a big number. Okay, so some of our prevention programs, you might be interested in knowing that your school systems, even Worcester, have had some of our programming. It's called Think Ahead. We go into your school systems and talk to the youngsters about how important it is to wear seatbelts in the car and why it's important to still be sitting in the back seat and what car seat they should be sitting in. If it may still mean that they have to sit in a booster seat. Or what does it mean to be a pedestrian? Believe it or not, our youngsters don't even know what the word pedestrian is. So we have to teach them. Now with cell phones, even our elementary school children are using cell phones, right? But they're walking around on our streets as a pedestrian on their cell phones and not watching where they're walking. So we teach them all about that. When we get to higher grade levels, such as middle school, high school, we're talking about how important it is to be a sober driver, not to be a distracted driver. These are all things we hope that sticks with them as they age, and they are hopefully preventing a TBI that would absolutely change the trajectory of their life. Some of the other programming that we do, so that's Think Ahead. We have a Brains at Risk program, which is actually, it's tailored toward the people that are actually coming our way because they've made some risky driving behavior. So someone gets an OUI, DUI in Massachusetts, a speeding ticket, texting and driving. They come to this particular program typically through the court system, like the Worcester District Court sends people to our Brains at Risk program. And it's a program that's not judgmental. We're not there to tisk at them for doing whatever they did to get themselves there. It's about making a change. How are we going to, next time when we're on the road, make a change to be that much safer to prevent TBIs? And we actually have speakers that come on that have lived experience with brain injury. So they've lived a life of possibly driving under the influence. And this is my life now, and this is what's changed. or I was hit by a drunk driver and this is how my life has changed. So we have that personal testimony. Survivor's Voice is a very, very similar type program, a little more intense because these are second offender DUI, OUI individuals. Okay, something that's really, really important, and this might resonate with you if you are someone that wants or needs services through our agency. We have so many support and resources that you may be able to utilize. If you identify yourself as someone that has had an acquired brain injury, so we promote the general welfare, rights, and dignity of persons with brain injury. We promote and foster the empowerment of persons with brain injury, assist survivors and families to obtain appropriate services and support, and provide information and resources for persons with brain injury and their families, friends, and professionals. So we have support groups. If anyone here has ever been part of a support group, this might be something that interests you. Our support groups are for people that identify themselves as a brain injury survivor that can come on and talk to other people that have similar situations. And if you've been through any kind of situation where there's a support group that supports you, you can probably testify, or it resonates with you, that it helps to be around people with like minds, like situations. You pass tips or personal stories back and forth to sort of know, again, that you're not alone. And that's our biggest thing, knowing that you're not alone in brain injury. Many people that have brain injuries feel isolated. They feel like people don't understand where they're coming from. Support groups help. And we actually have support groups for caregivers and family members. I mentioned to you at the top of the program, my father had a brain tumor. He went from a completely independent 50-year-old, I couldn't even get my dad a gift. He would poo-poo my gifts, don't need it, to a guy within a matter of months, completely dependent on us. The Hoyer lift came in, the hospital bed in our house came in. It was devastating. I know that he felt really, really alone and not sure how to deal with this transition so quickly. So we could help with that, but it also on our end was really hard as a caregiver. It was a very quick transition for us too, to have to now care for someone 24 hours a day. So there are support groups for caregivers of people with brain injury, and we support the family members, and they get a private space to be able to talk about what they're going through as well. Okay, some educational programs. I'm going to sort of slide through this a bit, but just know that we have educational programs for people, adults. I mentioned sort of our youth groups that are benefiting our prevention programs. We have educational programs for your clinicians, for your practitioners that see you. They need to be updated on the most up-to-date information on brain injury. So for instance, the pandemic. We just had a class for practitioners, a training about the neurological effects of COVID-19. You could have long COVID after being diagnosed with COVID-19, right, where your respiratory system is not the same. But you can also have neurological effects, long-term neurological effects of COVID-19. Short-term as well. I know I had COVID-19, and I felt like I had a brain fog. And that wasn't just something I imagined. It's a neurological effect of the coronavirus. And so we teach the clinicians about this so that they're aware when they're treating you. Okay? So if they need to hold, their licensure depends on them getting their knowledge increased every year, we can provide that to them. Okay. So that's a little bit about what we do as an agency. Know that after this program, I'll stick around for a little while. If you want to be able to contact us in any way, I can get you our contact information. It's at the end of the slide as well. But just know that we're here for you. We're a free resource. We don't ask for insurances. We don't ask for medical history. Whatever we can provide as resources and support, we're going to support you, we're going to support you, we're going to support you. We don't care who you are. We want you to know that we're there for everyone. We care who you are. We don't care what kind of background you're coming from, insurance, no insurance, that type of thing. We want to be able to help all. Now, this part of the particular program, we're going to get into what we've been talking about brain injury and how we can help, but what is a brain injury? An acquired brain injury is what we call, sort of be able to talk about it in broad strokes. So acquired brain injury is all brain injury. Think about it that way, in an umbrella term. And it's an insult to the brain that has occurred after birth and is not hereditary or congenital. It's a range of disorders and diseases affecting the brain. It's, again, happening after birth, beginning in the newborn period throughout the lifespan. A majority who experience the ABI are adults. So you have this umbrella term, acquired brain injury, right? But you have two types. The first type, non-traumatic brain injury, isn't any less traumatic than the traumatic brain injury here. It's just sort of how we categorize it. My dad, who I explained already, falls in this category with a brain tumor. It's an internal event, little less preventable. Brain tumors, infection, lack of blood flow or oxygen. We did not know that my father would have a brain tumor. Again, these are a little less preventable. Lack of blood flow or oxygen, an anoxic brain injury. If someone has a heart attack, but there's no blood flow or oxygen getting to their brain for a certain amount of time, but they live, could they have an anoxic brain injury, a non-traumatic brain injury? Traumatic brain injury, TBI, is the external event, brain damage caused by a blow to the head, car crash, falls, gunshot wound. So that's the difference between those two. They could have very similar outcomes, and you could have someone that sustains a non-traumatic brain injury like a stroke could have very similar outcomes or effects as someone with a TBI, maybe in a car crash, and you have bleeding on the brain, or that you have a contusion. That could be, you have very similar situations. However, also on the other side of that, know that just like every brain is unique, every person is unique, every brain injury is unique. I could have a very similar injury to someone else and how we sustained it, but we could have very different outcomes. Who's affected? ABIs are experienced by both males and females. Thousands experience ABI annually in all regions of Massachusetts. Most individuals survive their injuries. That's an interesting one. Over the time, our medical advances have advanced, right? So we're living through these injuries, but we're living the rest of our lives with ABI, with an acquired brain injury. What does that mean for you? So just think about that. So the leading causes, we talked about that, is falls. Other ways in people could sustain TBI, firearms, motor vehicle crashes, strikes by an object, person, explosions, like IED, improvised explosion device. This is our military. This is what we're seeing. Our military, our veterans come home with not only physical injuries to their body from the neck down, but we've identified that our veterans could have brain injuries, and it could be from the blast of a roadside bomb. This happened at the Boston bombings as well. It's interesting in the sense that, wow, so the bomb went off, let's say at the finish line, the bomb went off, shrapnel can get into the brain for sure, causing a TBI, but just the sheer blast, being so close, can actually shake the brain inside the skull, causing a TBI. So something to think about there. And then context type of ways in people sustain TBIs would be sports and recreation, occupational activities of daily living, interpersonal violence, we talked about military, child abuse, shaken baby syndrome, and homicide and suicide attempts. But again, with our military, sometimes the real battle starts when they come home, and we've done a better job at identifying our military with brain injuries in the last decade or so. Just another important visual there. Sure, I can read them to you, absolutely. So some of the is small font. More military deaths by suicide than in combat in 2012. Military suicides are at the highest rate in 10 years. 8 to 20% of military personnel deployed in Iraq and Afghanistan experience a traumatic brain injury. 300,000 veterans of the war in Iraq and Afghanistan have been diagnosed with PTSD. Brain injuries can increase suicidal thoughts and behavior. So this sort of bridges the gap between mental health and TBI, which is a whole nother ballgame. We could be here for another hour talking about the mental health and how that can interact with someone that has a TBI. Okay, so let's talk about falls and fall prevention. Falls are the most common cause of TBI in the US, we mentioned that. From 2007 to 2016, for older adults and aging population, it increased 30%. That's 7 fall deaths every hour by 2030. This is a big deal. 1 out of 5 falls causes a serious injury, such as a broken bones or a head injury. Each year, 3 million are treated in emergency departments for fall injuries. In 2015, the total medical costs for falls totaled more than $50 billion. Medicine and Medicaid shouldered about 75% of those costs. So something to think about here, 1 in 5 falls causes a serious injury, such as a broken bones or a head injury. You know, that could, you know, it can lead to, you know, physical downfall. Like that's, you know, once you have a head injury or you broke a bone, then it actually moves into, okay, now I'm nervous about moving around. I don't want to hit my head again. I don't want to fall. Does that then mean you're not out socially? It could be a slippery slope, is what I wanted to mention with that. So falls can, as obviously we just mentioned, broken bones like a wrist, an arm, an ankle, hip fractures. Falls can cause head injury, and it may not be apparent right away. You fall, you do hit your head, but you sort of, I'm fine, and you get up and you're fine, but then the next couple days, something's off. You don't always know how to describe it either. It's not this obvious way of explaining how you feel. The best way to describe sometimes is I just don't feel right. And then, like I mentioned, that fear of falling again, and sort of then does it lead to isolation and sort of not wanting to go out and be around others anymore because you have that fear of falling and you know what you went through the first time. Lower body weakness. Now, this is what anyone who might be at risk. If you have lower body weakness, if you have a vitamin D deficiency, that's not enough vitamin D in your system. If you already have some difficulties with walking in balance. And remember, the use of medications, certain antidepressants, sedatives, even some over-the-counter medications can affect the balance and how steady you are on your feet. You know, if you think about with any kind of vision difficulties, foot pain or poor footwear, home hazards are dangerous. So any kind of hazards at home or uneven steps or, you know, rugs at home that maybe you could get out of the way, those would help because you could be at risk for falling if you had those at home. Throw rugs or clutter that can be tripped over. So these are all things you want to think about. Maybe assess the home to make sure that these are not around to hopefully prevent falls. Excuse me. But I think the best way to prevent too is to talk to your practitioner, your doctor. Do strength and balance exercises to keep up. This doesn't mean you have to have any kind of strenuous go to the gym every day. It could be chair yoga. It could be taking a walk. You know, it doesn't have to be something super strenuous. And having your eyes checked and making your home safer, as we talked about. So some of the resources, I found a lot of these on the CDC. So that is actually this particular slide, if I was doing this virtually, usually I have this up there so that people can click it. But know that you can email us at any time, info@biama.org. And anything that I talked about today, we could absolutely fill you in on more information or that resources and support piece. You wanted to know more about our support groups. We have many recreational events. Now we're actually going back to some recreational events in person, which might be beneficial. They're all provided to anyone that identifies himself as someone that has an acquired brain injury. Our phone number there is as well. Okay, so wanted to quickly go over some of the functional. So what could happen after a brain injury? You could, it could affect your motor skills, your sensory functionings, your cognition, your communication and language. These can all be affected after brain injury. Some psychological effects of brain injury could be depression. That's the most common mood disorder after brain injury. Personality changes, social isolation and withdrawal, post-traumatic stress disorder, and anxiety. So these could happen after brain injury. You could experience chronic headaches and other disorders, seizure disorders, sleep disorders, and hormone disorders. Other risks among individuals that have ABI could be substance use disorder. Sometimes TBI for people can be a very slippery slope. So if you are someone that sustains an injury at work, and you're no longer able to work, are you able to keep up the finances at home? Does it lead to homelessness and unemployment? Does it lead to marital changes as well? It can be a very slippery slope. Believe it or not, we see criminal charges and incarceration after TBI because, again, the behavioral changes that are happening. After TBI, you can have poor judgment. This frontal lobe up here, your high executive functioning, if that area is affected, you may not be making the same decisions that you once were making. It can be very different. So with that, I want to let you know that the purpose, again, our purpose to provide support to brain injury survivors and their families. We want to offer programs to prevent brain injuries, educate the public on the impact of brain injury, and advocate for community services. This is, again, our phone number here. This is pretty much the end of my particular program, but I'd be happy to open it up to any kind of questions or comments anyone has. Usually at this time, I was at a senior center out in Springfield a couple weeks ago, and many people just wanted to sort of talk about, this happened to me, or this, I know someone that this has happened to. And I'm open to the next couple moments that we have to be able to talk about that as well. So yeah, go ahead.
One thing that I became aware of was my girlfriend hit herself with a shelf, with the corner of a shelf, and developed 2 blood clots. And then one day, she didn't make it to work, and she had passed out. So that was a big brain injury. So what did I learn from that? We have to be safe at home. Be careful with cabinet doors, be careful with shelves, be careful with rugs, be careful with any type of screen door or any type of shower doors. Also, I think that our children and our grandchildren who are into sports, football, boxing, or anything, experience a lot of brain trauma that is now being brought up to the surface through our media.
Some excellent points there. Getting your home, to a place that maybe near in the shower or near the toilet. You need to put something that you can hold on to. Wet surfaces. Make sure that the bathroom floor is not wet. You can slip and fall. And in the bathroom, we know there is sinks and things that are protruding out, cabinets, countertops that you could hit your head. And what is so horrible to talk about, but you have to talk about, is if you live alone and you're out, you're sort of left and you're unconscious. You have to be thinking about those things and advocating for yourself for safety in your home. The last thing I want to say about sports is absolutely true. We at BAA don't advocate for people not to play sports. It's to play sports safely and to sit out. If when in doubt, sit out. So if they feel like they have the coach feels they have a concussion, they've been hit, when in doubt, sit that child out until they're seen by a medical professional. There's so many things that are coming out with sports, professional and even our youngsters. It's very important that we're protecting their brain, absolutely. That'd be wonderful. Okay, over here.
Hopefully we'll never need it, but what are some examples of that fund, that services and treatment fund might be used for?
Yeah,
That, you know,
the
that's
head
all-
injury trust, yeah.
Vehicle accidents.
The head injury trust fund right now was a fund that was set up and through legislation to take funds from OUI, DUI, or speeding tickets to put into this fund, to the HITS fund, so that then it actually funds the statewide head injury program that funds programs like ours and agencies like ours.
My question is the person that was injured as a result of a vehicle accident caused by another eligible for any kind of funds that we should know about?
Yeah, so I think that's what I'm trying to get at and trying to clarify, that it goes more to the agency level that then helps people that way. So the head injury fund isn't a fund where you could go and get a grant yourself for specific monies. It's more that particular fund funds agencies that help individuals, and that's like the statewide head injury program, which then funds our agency, the Brain Injury Association of
So
Massachusetts.
what kind of help do you provide to those individuals?
So resources and support. So when someone was injured after a brain injury, they could come to us and we could help them navigate through the healthcare system. So, I have had a brain injury. My eyesight has not been exactly the same. I need some help there. I don't know where to go. So we would help them through and sort of be that advocate through the healthcare system to try to say, this is a place that we know that helps, with vestibular or certain types of speech language pathologists. We have some that we work with closely. Occupational therapists, physical therapists. We would point you in the right direction to be able to get the services that you may need.
So if the cause of the accident were uninsured or not adequately insured, you wouldn't provide any funds that exceeded the individual's insurance coverage?
No, we're not a fund. We don't have any funding in that way to give out any monies, no.
I would like to answer that question over there as far as that fund that goes. Anybody here that has a relative or a friend or family member can access billions of dollars in Congressman McGovern's district. Congressman McGovern has helped me since I got out of the military in all phases of going to college and getting into society and having something still left to play with. So a brain is very, very useful on one side of your head. On the other side, it's not useful. So I was married twice. Enough said.
She's asking, I know you talk about brain injuries, but how about strokes? Do you also help with that?
Yes, so we talked about those two different types. Non-traumatic and traumatic brain injury, so stroke, something like a stroke, or something like being hit in the head in a car crash. Both of those are considered acquired brain injury, and we absolutely help anybody that comes our way that has had or sustained those injuries. We can help you with support and resources. So our friend over here, what kind of help? I think that may not be clear. So you could come to us so that we could help you with the next steps on where to go find doctors. I don't have transportation. Well, we know the Mass Transit has a particular program that helps people in this that may have brain injuries. We're going to help you find that. So we're sort of your health resource advocate to say these are the things that we know work for people with brain injuries. We want to pass this information, these resources and support to you. Okay.
I have a question. So you just said about transportation. So I know I've talked with some people who have had something or they have a brain injury now, from some incident or fall, or and transportation's always an issue for people.
Right.
And so we do our best, but am I to understand that we could maybe reach out to you? You might have some other
Yeah.
means
Yes,
available?
that's exactly right. So we
Okay.
have people waiting by the phones. They're called information and resource specialists that know about all these types of things. I come out and tell you that we can do those. I don't have all that information here. Our information and resource specialists can help you navigate that and say, well, I know this particular, in the Worcester area, I know this transportation program helps the people with TBI. Yeah. Call our number, which is 508-475-0032. And then that is where you can talk to someone that could have some help for you.
And I just wanted to mention one more thing. So here at the senior center, when someone has a fall, we call 911, even if you feel you're all right, but we always like you to be checked out by the EMTs or the fire. It's your decision whether you want to go to the hospital or not, but it's our protocol that we would call and just have you checked out. And especially if you hit your head, we want you to be checked out. Because I think, as Justine said, sometimes we don't know. Like, you might feel all right, but you never know. So,
It could take up to days to feel the effects of brain injury. It's not always immediate. Sometimes it is. Sometimes it might be later and you don't make the correlation that you hit your head 4 days ago. Now it just, why do I have this horrible migraine? It's hard to give all the examples, but I think you get it. Just know that it could take, several days to feel the effects of actually hitting your head in some cases.
and I'm correct in understanding, Justine, that it's okay to call you to get, like, this is what happened to me. I'm not sure if this is like under a brain injury or not,
Yes,
but.
I think that's a great closing thought, is you may not know. It's so vast on how people sustain brain injuries. Call us, we'll talk you through, and absolutely, I think we could absolutely help in that way. If you're just not sure, sometimes people want to call just to talk about what's happened to them. I'm not ready for resources yet. I just want to talk to somebody about what happened to me. We are there for you as well. It's called coping and counseling. We'd absolutely be able to have people give us a call so that we can take that first step for you acknowledging or even verbalizing for the first time, something's happened to me. And then we go from there.
Great.
Well, thank you so much, everyone, for your time and attention today. If you have any questions after today's program, feel free. I'm going to go back to this number at the end to keep it up here for a moment or so. This is again, we have just several different lines, but this is our toll-free number, 1-800-242-0030, or our website right there, email address.